been the law of the land for quite some time, and with the Affordable Care Act, they were implementing slowly. So a few of the changes have taken place already, and then we know the why. We know that our healthcare costs are quite high, and in our world, if someone has allergies and they try to get private insurance, they're denied. If someone has had a divorce and they've been to see a counselor, they are denied on the individual market. So something had to be done about getting people affordable coverage, but getting them covered so that they can take care of their needs. And there are a lot of great things about the benefits that are included inside the Affordable Care Act that we're starting to experience already. So 600,000 uninsured Oregonians, 48 million uninsured Americans, and it is the greatest cause of bankruptcy in our country today, are those healthcare bills. So the majority of the changes are going to take place in 2014, and that's why every paper that you pick up is really talking about that. So today, from 2014 to today, we have the elimination of lifetime limits. So there used to be a $2 million cap on healthcare. So if you had a policy, something catastrophic happened, there were limits. So we're going to eliminate those lifetime limits. Dependents can stay on their parents' plan to the age of 26, whether they're married, not living at home, and not a dependent on their tax return. So it provides the child the opportunity to get established in a job and stay on their parents' plan. No cost for scheduled preventive services or well baby. So all of your preventive care, your mammograms, colonoscopies, your well visits cost you nothing. And women's preventive services and contraception come at no cost. Elimination of pre-existing condition exclusions for children under the age of 19. So this, in January, will go away for everyone. So no more pre-existing conditions. We won't take a look at any of the health issues that folks have. Summary of benefits and coverage. There's a lot of confusion surrounding the benefit summaries. So they've established this summary of benefits and coverage. So across the board, every carrier has to outline the coverage for all of their plans so that when you compare, they're in the same place and they're identified the same way for transparency and consistency. And then we started to see those fees and taxes you've heard about. The patient-centered outcome research fee is $1 per employee this year, and it's going to be $2 next year, and that's part of the research and the funds to pay for this. So in January, all Americans are required to have health insurance or pay a penalty. Benefit plan designs will change. So every plan that you know of today will end. So the way that we do things, where we're experts, people come to us because we know our plans. We don't know anything anymore. Everything is changing, and we're having to relearn every carrier and every plan and every guideline. Reporting requirements for businesses. So the Department of Labor, if you are an employer, whether you offer benefits or not, there are regulations that you have to follow and notifications for your employees. And so there's a lot more compliance issues with the Affordable Care Act. We talked about no health underwriting. I'll go into that. There's a wellness incentive. You can charge 50% more premium for a non-tobacco user than a tobacco user starting 2014. The Cover Oregon Marketplace opening, so it did open on October 1st, and they are diligently working in the background to fix some of the intricacies and the things that aren't working. So today you are able to go on coveroregon.com. As an individual, you can put in your age, your income, you can look at examples of plans and see the cost, but as an employer, we don't have that information yet. So we can look at the plans that are inside the exchange, but we don't have any of the costs, and we aren't able to see what that looks like yet. So how many of you, when you've seen the billboards or the songs, knew that Long Live Oregonians was the Cover Oregon Healthcare Marketplace?
Not first.
So that's where a lot of the billboards and a lot of the signs and the music, they talk about Long Live Oregonians and Cover Oregon, but no one really identified. So that is our healthcare marketplace. That is our exchange. So as you're out in the community where you see Long Live Oregonians, this is our state exchange. So it is open for shopping. So think of Expedia.com and how when you go out on Expedia and you're looking for airline tickets, how they're all by price, or I search by airlines. You can do the same thing here. So in the exchange and with the new plans, a lot of the carriers are redefining their networks. So where you may have heard you can't go to the doctor you want, and they're going to tell you what doctor to go to, and you might have a United Healthcare plan or a Providence plan, and that doctor's not in the network. Well, you can actually search inside of Cover Oregon, and you can search for your doctor, and you can find a plan that has your doctor inside of it, inside that network, so that you'll be covered. So financial assistance, so for employers and individuals who go into the exchange, it will be the only way for people to get a tax credit or subsidies to purchase benefits in the exchange. Purchasing, small employers cannot get a tax credit unless they go in the exchange, and the only way for an individual to get a tax credit is through the exchange. So price, choice, transparency. The rates are based on your age, your zip code, and if you're a tobacco user. And those are the three criteria for determining rates. The subsidy will depend on income. So as an individual, you can still go inside the exchange and purchase benefits. The application process is, you can imagine, is quite daunting, excuse me, because it's all based on financial information. So if you think that you will get a tax credit or a subsidy inside the exchange as an individual, then you would fill out that information based on your income. If you know that you won't, because and I'll show you some rates here in a minute, then you would purchase insurance outside the exchange, because there is no more health underwriting and it will be a simpler process. So 27 federal states have federal exchanges, 17 states have opted in for a state exchange, and 6 have a combination of both the state and federal exchange. So when you think about the Olympics, and you have bronze, silver, gold, and platinum, that's how our plans will be today. Catastrophic plans are only available for people under the age of 30. Everyone else will have to choose a bronze level as that minimum value standard. 60% of the overall costs of that will be paid by the carrier, 40% by the individual. Then there's silver, gold, and platinum. So the higher the premium, the lower the copay, and the lower the out-of-pocket. These are the individual carriers that are participating in our state exchange. A couple of them are not in our area. What you will notice is we have 2 co-ops, the Oregon's Health Co-op and the Health Republic Co-op. So they're trying to do things a little bit different. There are going to be a lot more items that are under a copay, similar to the Kaiser model. They are recognizing naturopaths as primary care physicians. They're still trying to determine if a naturopath prescribes a supplement, are those covered under the prescription plans? Probably not initially, but so you can see the way that healthcare is evolving here. What you don't see on the board is United Healthcare. You don't see Regents. They have opted out of the exchange. They have determined that they're going to wait. They're going to see how it goes in the exchange. And there is a cost to be inside of the exchange. So we still haven't been able to compare the rates quite accurately yet for January, but we're curious to see if they're not opting in the exchange, will their rates be lower because they're not inside here. So that's more information to come. In the small group market, there are fewer. So we do still have those 2 co-ops, and then Pacific Source, Providence, and MODA, which you all know, but the MODA Center, ODS, is also in. MODA's rates have been overall the lowest. They came in quite low. So tax credits or subsidies inside the exchange. So if you have, in the yellow box here, if you're an individual and you're making $22,980, 200% of federal poverty level, and you purchase a silver level plan, you'll get some additional assistance for lower co-pays, lower co-insurance. If you are earning, so up at the top right corner, that $45,960, so there is some type of relief for people in this area of household size and 400% of property level if you purchase inside the exchange. Our plans today have 10 essential benefits embedded in the plans. So in Oregon, we have, most of our plans have come with alternative care and behavioral health, mental health, prescription has been a rider that you could add. These benefits will be included in there. What you see is pediatric dental and vision. But most importantly at the bottom, this out-of-pocket maximum. So the maximum out-of-pocket on a plan can be has to be $6,350 or less, and 2 times for a family. In today's world, that out-of-pocket maximum at $6,350 is 3 times for a family. So when you think of cost and the increase that they talk about Affordable Care Act, well, the benefits are more comprehensive and the cost is increasing. And that's part of that. We're seeing part of that increase is because of the essential benefits and the way that the benefits have been compiled inside the plans. So this is inside Cover Oregon. If you go to coveroregon.com, I chose a 40-year-old non-tobacco user in 97209 zip code. This is a bronze level plan. So you have the bronze, silver, gold over here. You can, choose the level you want. So if you're someone who knew you were going in for surgery, you knew that you were going to need some care, you choose a plan that has a little bit more benefits included. But the basic level of benefits that are required by law, this number to me, for what we see in the marketplace, seems low. Does it seem low to you? So you'll be able to compare. So MODA, as you can see, the top 3 that popped up for this particular 40-year-old male were MODA in that $165 a month range. And then you can compare, you can scroll down and compare the plans, and then they go across. So then you can see your plan costs, your out-of-pocket, how much are your physician co-pays, what are your specialty co-pays, how much does it cost to have lab work done. So you can easily compare side by side what those benefits are included in each of those plans. For groups to go inside of the exchange, they can purchase 4 ways. So you can do what you do today. Some companies, they have one plan that they offer for their employees. So you pick a defined contribution. I'm going to give you $300, and you go inside the exchange and you purchase this plan where it says Carrier B. So say Carrier B is Providence. They would go inside, pick that silver plan, and they would pay $30, and $300 would be contributed by the company. Well, our small groups are really loving this concept because for the first time they don't have to dictate the plan and they don't have to dictate the carrier. But where large companies can offer 2 different carriers or many different plans, this isn't a way for our small employers to pick in the carrier choice or in the multi-tier. One of you could pick Providence, one could pick Pacific Source, one could pick Kaiser. The employer gets 1 bill, and you pick a defined contribution, and you pay the difference. So what scares Steve and I is this broad choice, so that if a company says, you pick the plan you want, and that, we know now when a company offers 2 plans, people have trouble choosing one or the other. Imagine if you have 20 different plan options, how you're going to be able to choose what those plans are. So again, it would funnel all through the exchange. You could pick all the different carriers, and Cover Oregon would send you a bill. And you pick that defined contribution. So all you have to do as an employer is determine your base plan, and that's the plan that's highlighted in these examples.